video will focus on the different linkages in the management of acute malnutrition and other programs within the Ministry of Health and in other ministries. The linkages we will discuss mostly fall within the UNICEF conceptual framework of malnutrition, specifically within the immediate and underlying causes. Immediate causes are related to food and nutrient intake and to health. Persistent deficits in nutritious food and frequent attacks from infectious disease all constitute immediate causes. Underlying causes are embedded in the household and in the community. These include agricultural practices which are not sustainable and nutrition sensitive, climate change, lack of access to clean water, poor sanitation, lack of health services, and so forth. Therefore, IMAM cannot be effective as an independent program or if we operate in silos. A multi-sectoral approach will improve all stages of IMAM implementation. Linkages can be intra- and inter-ministerial. There's need to identify and engage key sectors and programs in the locality, such as agriculture, social services, education, and local leadership. Some of the possible ways of integrating IMAM with other health services, such as PMTCT, OI or ART, and IYCF, include but are not limited to the following. EPI. During EPI outreach services, integration with IMAM may include active screening by village health workers at EPI outreach points, and follow-up of IMAM patients can also be done by health workers. Integrated outreach services with IMAM is a collaboration that has proven to be effective. It decentralizes various health services to hard-to-reach areas which would otherwise not be covered by health centers. Hence, no one is left behind. Deworming and NTD. Routine deworming and control of NTDs is also essential for the prevention of acute malnutrition and improving children's health. Therefore, children under management of acute malnutrition need to be dewormed to prevent nutrient losses to parasites. PMTCT. Education on the importance of exclusive breastfeeding in the first 6 months of life, good breastfeeding positioning, attachment and adherence to ART are critical in minimizing mother-to-child transmission. OI-ART. In breastfeeding women, adherence to antiretroviral therapy is critical in minimizing mother-to-child transmission. Children on ART are to be given medication on time. Mothers and caregivers should be made aware that HIV-exposed infants may grow slower than their unexposed counterparts. Therefore, educating pregnant mothers and lactating women to identify signs of malnutrition in children is important. It is especially important for mothers and lactating women to be able to identify the signs of acute malnutrition in children under 6 months of age and to be able to use FLM to monitor nutritional status of children that are above 6 months of age. IYCF. Mothers are encouraged to join IYCF support groups, care groups, and attend PD health sessions where they can share infant feeding experiences and best practices. Therefore, a mother whose child has been discharged from IMAM can be linked with these if not already a member. Optimize IYCF community support and PMTCT follow-up support for mothers and infants. Improve integration of IYCF and PMTCT interventions, including early infant diagnosis within routine facility-based MNCH services. Ensure HIV testing within IMAM services and ART initiation or referral for ART. Integrate screening for malnutrition into pediatric HIV and PMTCT services with severe acute malnutrition treatment or referral to IMAM. Food Security and Livelihood Programs, FSLPs. Household food insecurity and lack of sustaining livelihoods is among immediate causes of malnutrition. Therefore, linking households of malnourished children to FSLPs will go a long way in preventing recurrence of acute malnutrition. For example, startup of bushveld chickens, which lay eggs that families can feed children, and selling excess to buy other food items they require. Such families can also benefit from government food assistance through Department of Social Welfare and input schemes through the Ministry of Agriculture, food vouchers, and cash transfer programs from partners operating within those districts. Thus, IMAM registers should be another source of beneficiary identification and registration for FSLPs. Social services and social safety nets are also crucial for successful IMAM programs. Often, when the biological mother of a child is deceased, children find themselves under the care of relatives that may be incapable of taking good care of them. For example, a child under the care of an incapacitated caregiver, such as a grandmother, or a person living with a disability, or a cruel stepmother. Caregivers in such instances may not be able to run around, prepare nutritious meals, and feed children. There is also issues of child abuse and neglect, which need to be addressed when assessing a child upon admission into IMAM. There is need to check for holistic approach, not just looking for IMAM signs and symptoms. A child coming from an abusive background would need to be put in the custody of a caring next of kin and, where possible, linking with law enforcement for prosecution of offenders. It is therefore necessary to work together with the Department of Social Welfare to find a capable close relative or consider foster or institutional care. Emergency preparedness and response. Emergency preparedness and response in times of cholera and natural disasters such as cyclones and droughts prevents and controls the incidence of acute malnutrition. Timely responses with food rations meeting minimum standards for humanitarian response will cushion households and prevent cases of acute malnutrition among the internally displaced during disasters. Active screening for malnutrition should be done in camps where displaced persons are resident.